All right, good afternoon, everybody. Thanks for coming. My name is Scott Para. I'm the President and CEO of Mohawk Valley Health System. Thought I'd introduce for you who's here today. Immediately to my right is Dr. Andrew Bushnell, who is the Medical Director of Emergency Services for the system. Sitting next to him is Dr. Eric Yoss, who's our Senior Vice President and Chief Quality Officer for our system. To my immediate left is Dr. Michael Trevisani. Dr. Trevisani is the Senior Vice President and Chief Medical Officer for our healthcare system. Sitting next to him is Pat Roach. Pat is our Senior Vice President and Chief Nursing Officer. And sitting next to her on the end is Angela Belmont, one of our Assistant Vice Presidents of Nursing, and Angela has direct responsibility for the emergency services amongst other departments within the organization. So we're here today really from our perspective to talk about two things. First is to assure the community that both of our emergency departments provide exceptional care under very complex conditions for both adult and pediatric patients. It is safe to bring your child to our emergency departments. Second is to discuss the article that appeared in yesterday's Observer Dispatch. And I must say that I felt that the headline kind of over-sensationalized the actual article given the size of the typeface that was on it. In the March 1st letter that was referenced in the Observer Dispatch article, several cases were referenced. I want everybody to be clear. As soon as that letter was received, Dr. Trevisani and I met. Dr. Trevisani and Dr. Bushnell met the next morning, and we began an investigation. We look at that letter as we do with all of our feedback. We take it very, very seriously, and it's very important to us as a system. What I'd like to do now is have Dr. Bushnell and Dr. Trevisani walk you through the process of emergency care and also how continuous quality improvement works at Mohawk Valley Health System as well as other organizations. Dr. Bushnell.
Thank you, Mr. Para. Good afternoon. So I'm going to start by describing what happens to a patient as they present to our emergency department. Our patients walk in typically through the front door of the emergency department. They're greeted by a registration clerk who takes their name, their date of birth, registers them in the system. They're seen by a triage nurse, and right next to that triage nurse is a provider. That provider is typically a nurse practitioner or a physician assistant. We place that person out in triage 12 hours a day so that we can expedite care. We don't want patients to wait in our emergency department longer than they have to. So by placing someone out there, a provider in triage, we're able to see that patient faster, start lab tests, perhaps order a key radiograph, get that patient seen faster. For simple cases, cases like sore throat, cases like sprained ankle, we can treat that patient just with that provider and triage interaction. An exam is performed in that area, either in a minor treatment area right next to that triage process or in the triage room itself, and have the tests come back and have that patient discharged so they don't have to wait. That expedites care and saves about 30 minutes overall on our patient's care that we average across all our patients. In addition to that, when our provider in triage starts tests and the patient is more ill than a simple injury or illness, they come back to the emergency department main emergency area, and they're handed off to one of our regular providers. That provider continues the care that was started out in triage. The patient is seen, treated appropriately, consultants are called if needed, and the patient is either discharged or admitted. Throughout the process of emergency medicine and any type of medical care, there is always the opportunity for quality improvement. That's how we challenge ourselves. That's how we watch our specialty to make sure that we're not missing an opportunity for improvement. And in order to do that, we look at each case by case that comes up as either a complaint or an issue. We review that with our quality improvement team here at the hospital. We review that with the patient's family sometimes with the provider who's a consultant. And we come back and we say, how can we have made things better? Or did we do the right thing? That's a simple process. It is done continually here in the Mohawk Valley Health System, as it is in every emergency department is successful, and no business is successful without looking at how you perform on a day-to-day basis, and we do that here. Thank you.
Many clinical care cases, in this case falling into the area of pediatrics, are discussed at the pediatric department meetings. Myself, as well as Dr. Bushnell, the ER medical director, attend many of those meetings where we witness what goes on. Many of the cases are found to have what we call standard of care was met, and we move on. Others, where there are questions, we refer on to a peer review process. The process, I think, is very robust here, involving physician-led, and we dissect each and every one of those cases as to where we might have had opportunities for improvement. Where we do find those opportunities, we do institute educational opportunities for the providers, physicians, nurse practitioners, physician's assistants, and anyone else involved with the care. And we also monitor those cases, those similar types of cases, as we go forward. In some cases, we need to be transferred out of the area for care to a higher level of care. We have very skilled providers here. However, some cases are outside the capacity and capability of what we have here, and so we do transfer to a higher level of care. A case that was recently mentioned, I felt, after reviewing the case, and since we don't have a pediatric surgeon here, I felt that the patient would be in better hands after stabilized here, being sent to that higher level of care where there was a pediatric surgeon available. There's been a discussion of what motivated the final act. I've been involved and have engaged pediatricians in many of these issues. It was described by myself that maybe on-call was one of the tipping points. On-call, as well as the quality issues, was certainly their concerns. We have many quality pediatricians, and they provide excellent care, and they brought up these questions appropriately. But I felt that we had addressed these questions, we looked into these cases, and the last item that remained was the call issue.